Hi, welcome to another episode of Wellness Insider. Today we're going to talk about arthritis not being an age-old problem anymore. Today we have Dr. Suresh with us. He is an orthopedic surgeon and associate professor. Yes, tell us a bit about yourself and what do you do?
Okay, so I'm an orthopedic surgeon. I've been in practice for about more than 20 years. And I began my career in the National University of Singapore, so I'm born and bred here.
Yes.
And I spent a few years in New York in the Hospital for Special Surgery and the Sloan Kettering Cancer Center to learn about very advanced techniques in joint replacement surgery and oncology.
Okay. So what is your field of specialty?
Well, so I'm an orthopedic surgeon, and I left Singapore essentially as a joint replacement surgeon.
Okay.
But when I went overseas, it was really to develop the skills in handling the really complicated problems, like when joints just can't be used anymore and patients are facing like end of the line kind of procedures.
Okay.
So I'm a revision surgeon of very, very advanced damage to the joint. And so I've seen the whole spectrum of disease from fairly minor things to really major things where the patient can't walk anymore and needs a solution.
Okay. So arthritis, I mean, it's a common problem that we see nowadays, but no one actually knows very much about it. Can you tell us more about it?
Okay, so arthritis, effectively, the word arthros is joint, itis is an inflammation, so inflammation of the joint. And in two broad arms, they exist in an inflammatory version and the age-related version. So now, the inflammatory version is essentially things that are associated with things like rheumatism and gout. And really, for the purposes of today's discussion, we can sort of put that aside as a problem, but not a problem we're going to be talking about today. As for the arthritis related to age, that's related more to wear and tear.
Correct.
Yes, it is correct.
Yeah. It's very interesting to hear about.
And it's also predisposed to by various very subtle changes that a person may have. So not everyone is the same. If we look at any of us in the room right now, each of us probably has one leg longer than the other. But in the grand scheme of things, we kind of all seem like we're okay, but there's always a subtle difference. Maybe we're a bit more bow-legged, maybe we're a little bit more knock-kneed, maybe our knees kind of turn in when we walk. And all of these cumulative things result in forces around the knee that are abnormal, and so you're more likely to wear out a small spot in the knee, and then after a while that sort of spreads out into the rest of the knee. So that, by and large, is how it happens in most cases.
Okay.
In occasional cases, and increasingly with a very sporty younger set and older set, everyone's getting into sports now. So, and it's true, everyone is getting into sports. And I myself, I run a lot, I work out at the gym and all that. And I grew up in Singapore, and over the years, you just see this amazing explosion of fitness that's overtaken the country, and it's 20.
Everyone wants to get more active.
And 20 years ago, we were, this was not.
People want to take care of themselves more.
Yeah. So it's really nice to see, but along with that, the injuries will come.
Yeah. So arthritis, like you mentioned before, that there's a culminative variety of factors, mostly environmental, right? So it's more like the way you walk and everything. So how does aging come into this?
Okay, so let's take you, for example.
Okay.
Okay, so when you were young, you could probably lie on the floor, put your leg behind your your head or something, and that will be easy. If I were to ask you to do that now, you end up in the emergency.
You don't want to know that. That's not a nice sight.
No, but she's
yes, she can do
she's
that.
doing it. So the one of the big things about yoga, for example, is that need to get back to that time when you were flexible. Now the kicker is, when you were young, you're inherently flexible, and you're formative, and your tissues haven't picked a direction. You're kind of this malleable kind of person, and all these forces are essentially accommodated. You're like this stretchy rubber band. Now, as you get older, you get stiffer. Your ability to take shocks and bounce back and to recover and to heal, it all gets affected. And it's very complicated. The age effects, you don't want to say some age is a disease.
Yes.
But the reality of aging is our ability to regenerate is affected. And so you don't have the same kind of ability to regenerate tissue like you did when you were young. So the great example is Dolly. Remember Dolly the sheep?
Yes.
Yeah. So the great thing about Dolly the sheep was, now Dolly the sheep was cloned when she was old.
That's why she can't.
Correct. And all the progeny of Dolly died early.
Yes.
Because essentially you
telomerase
frame shifted. Right.
activity.
Telomerase.
Yes.
I'm impressed. So telomerase activity.
Yes.
Exactly. So telomerase.
That's the whole process behind aging.
Yes, and it gets shorter and shorter, and after a while it doesn't have the ability for regeneration that you have. What else are you going to impress me with?
No, I actually wanted to ask you about...
You tell me.
I actually wanted to ask you about how gout actually plays a part in this. What is gout in comparison to arthritis? Because it's the formation of the crystals in the joint.
Correct.
Right?
So gout is one of those causes of arthritis that tends to be associated with the younger set. And so whenever a person comes in, say in his 40s or something, or late 30s, and he's got bad knee pain. I just had a case today, and he came in with bad knee pain on one side, and when you do an x-rays, he's got very advanced arthritis. Now that is not expected of the kind of person who has those subtle changes that result in arthritis. So you really want to go and find out what predisposed him to having that arthritis. So one of the big ones that comes up is trauma. So did you fall? Did you twist your knee? Did you tear a ligament when you were younger? Did you have surgery? So if there's none of that, then you start to get into the rheumatic things. So gout is under these rheumatic things.
Okay.
And so when you ask about gout, he'll tell you, well, it started off with this pain in the foot. He gets it when he drinks beer. And then you get this one joint that always swells up and it's painful. And that's actually what happens is essentially you have these crystals, gout crystals, uric acid, urate, they kind of precipitate out in the knee, they cause an inflammation. And then your body doesn't know when to stop. The inflammation that starts, it doesn't know where to stop. And it starts attacking the knee, and that's...
So it's autoimmune.
It's kind of autoimmune. We generally reserve the term autoimmune for when you have no problems and then your body just creates an antibody against your normal tissues, and then you start to fall apart. And that's autoimmune. Here, really, there's something wrong, and your body just doesn't know when to stop. It just keeps attacking those crystals, and then the inflammation, has collateral damage, and your knee goes to pot.
Yeah, very interesting.
Yes.
So as you mentioned, you actually see your clients now. They're
I
not
like to think of them as patients.
Okay, your patients now. They're not exactly in the older generation. They're more in their younger.
Well, I see all kinds.
And
so the next knee replacement I'm going to be doing is in a mid-80-year-old person, and that's about as old as they get when you do joint replacements. But guess what? I'm doing knee replacements for people as young, for people as young as the early 40s. I've done hip replacements for teenagers.
Wow.
Yeah. So
due to injury.
well, with the teenagers, and these are 17, 18-year-old teenagers, they have those, that subtle thing that I was talking about. Now, these subtle things in these teenagers are taken to an extreme. And then they develop very premature arthritis. They end up taking medications to try and alleviate their symptoms. And then the medication causes side effects. And they end up with severe arthritis, and they're crippled at a very sensitive time in their life. And so, you end up with joint replacements. But the other category, which is these young adult at about the age of 40 undergoing knee replacements. Now that's a very controversial kind of group, because excluding the group that has rheumatic disease and gout and autoimmune disease and rheumatoid arthritis, now that's a separate group, and like I said, we won't be talking about those today, but that's a group that, yes, you would have to do knee replacements at a younger age. Here we're talking more about young people who have very severe arthritis, and it's just not an expected thing. You'll do 20, 30 knee replacements on a normal person and have one young person. So it's really not a common thing. So what does that tell us? Is this a new phenomenon? I think it's not necessarily a new phenomenon, because, I'm kind of interested in anthropology and stuff like that. So the human form, Homo sapien, we've been around for 150,000 years.
Depending on which calendar you're on.
150,000 years. And so the Neanderthals were overlapped by 50,000, and we were a separate species for 100,000 years. So then we have not changed. We're essentially the same kind of. And so with all of that, it's highly likely that those problems that we have of a physical nature, that means the ligamentous things and the arthritis and all of that.
It's due to lifestyle.
No, that was probably there before, but I think what has happened is we're much more aware. And so, if you're out there and you're hunting the woolly mammoth,
you're not going to be thinking about
your knee pain, you just want to get out of it. But when you now, right, like you're sitting down, you're interviewing me, and then your knee is starting to hurt. What in the heck is going on? Why is my knee pain? So you become very aware of things. Now you then go onto the internet, you start speaking to friends, and there's social networking, and then you begin to realize, hey, I should not be this way. So then you go get yourself checked. The medical investigations are all are available. They're not this mysterious thing that is hidden behind some vault that you have to go through 10 guards before you get to this, this little prize or something. And so that kind of accessibility is there, you see. And so now people will see it, they'll realize they've had an injury, and then they need to do something. Specifically, for example, in the young set. I remember a time like 20 years ago when I first started practice, and if you wanted to order an MRI, you had to go through a fair bit of bureaucracy to get an MRI, because like the whole country might have had 4 MRI machines or something, and we're really good, At one point, the whole of Canada had 4 MRI machines. So
really,
now you find like 5 MRI machines in one floor in a medical center. And so the accessibility of these media modalities is very, very high. And so back to this thing about the knee, you would have a typical young person who had an injury, a national service boy, who had an injury.
Hush, hush.
Yes. National service boy has an injury. You would examine him. If you're an orthopedically trained person, you would have a strong index of suspicion that yes, you've got a meniscal tear. a medial meniscus tear or something, and you need to have something done. Now, without the MRI, the next step would actually be an arthroscope. So you have to go for surgery, stick a probe in there, and look around. Now, not many people are going to want to go through that. So what will they do? They'll say, no, you know what, I'm not going to go through that, I'm just going to bear with it. But now, when we have the MRIs, essentially we're making these diagnoses much earlier. And so the patients are very aware that they have meniscal injuries. The resolution of MRIs are so good that they can tell, even with very minor variations in the cartilage in your knee, that something's wrong. Now, it's not a great leap of faith to suddenly realize that, well, if we know now that this person has got this wear and tear in the knee, there is a strong likelihood that very soon he's going to get arthritis. And so a lot like what's happening in the cancer world with screening and all that, people are making the diagnosis early and earlier.
Which is good, because the earlier you catch it, the better it is.
So here's the kicker. There are some things that we can catch early and do something about. Like, for example, if your meniscus is torn, you can go in there with an arthroscope, 2 little stabs, and we'll repair the meniscus. And that's nice, elegant surgery, 15 minutes, half an hour, you're done. And it's got a long-term thing. But what if, you have an unusual knee or an odd little walk, and that odd little walk is resulting in you now having a bit of wear? Now what do you do? So do you say, well, you walk funny and you've got that wear of cartilage there, let's cut you up and change you around? And I don't think so. So you're not going to do that very often. And so people will now realize that, it's a bit like that. It's a bit like the Titanic, when you see that you're about to hit the thing and
the iceberg, and you just
whatever, and then you just you go for it and then you sink. So it's a bit like that, because you're making the diagnosis early, but then the steps required to change it are just so onerous that you're not going to go through it, and you're going to result. So between those two extremes of the obvious things that has like minimal investment on your part, to the other extreme, which is a pretty serious problem but just too much of an investment to correct it, within that range you will find that this diagnosis of arthritis is being made earlier and earlier, not necessarily because we want to do anything about it, but certainly because we've made the diagnosis.
Okay. So now I need to ask you a question.
Please.
Knee replacement surgery. Is it true that you need to get both knees done if you're going to get it done?
No. My mom has one side done.
Really?
Yeah, sure.
Oh, because, no, my dad, he actually has arthritis.
Very good. So men.
Yes.
Men in particular. Okay, so I love this question. Okay, because you've seen this kind of thing all the time, and so when a woman walks in, it's usually, and you talk to her, and she'll tell you, no, she's never had trauma. She's been a sedentary housewife her whole life. A bit of housekeeping and no real specific injuries. Now that's the kind of person, and if you take a look at her, she's bow-legged. She's bow-legged.
Okay.
Now that's the typical kind of person who's probably going to get arthritis in both knees, and it's going to be the same. And so you're going to do one side, and in the end she's going to need surgery on the other side. The reason being, once you've done one side, she's going to feel so good on that side that
she's going to rely on.
I want the other side.
Oh, really?
Done. Yeah, they'll actually, because don't forget something, when patients start getting dependent on painkillers for their pain, right? What will happen is they'll begin to see that the side effects of the painkillers are starting to take their toll. So they get kidney failure, they get heart disease. And so, painkillers aren't meant to be taken more than a month, I've seen patients who have been on it for 5-6 years, and they've actually begun to have kidney failure and things like that. And that's something that I see repeatedly, and I don't think enough of that information gets around. Now, if you contrast that with a man, being the inferior sex, you understand.
Of course.
You understand. Let's put it out there. That's why we only get one knee. It's only one knee. Women have both knees.
So you get one knee kaput.
That's it, inferior people. So men.
Yeah.
Yes. So the thing about men, when they come in for their knee replacements, very often they've had some trauma in the past. So they'll actually tell you, they twisted their knee when they were younger. Now, in fact, the age of the national servicemen, the first of our national servicemen, they're coming in with arthritis in one side because they fell off a truck, twisted, running the SOC or something, and twisted some 20, 30 years, 50 years or so. And now they're having pain, but only in that one knee. And they'll be able to tell you, well, I traced this back to when I was doing that and doing that. Now, if I were to ask you, do you remember a time you had a bad fall?
Yeah.
Okay.
Yeah.
You hold that thought. And now I ask you, has that had any residual effects on you?
Of course.
Okay.
Yes.
So you see, that's the strange thing about people. They know,
Yeah.
They actually can tell you
exactly when.
And the thing is, when you are on the other side, often you're like, I don't think so. But the reality of it is, if it was so significant, they'll actually register it. Because you've fallen any number of times, and you don't remember those things, but you actually remember the time I fell, and after that I never walked right. I fell when I was, really young, and I was looking at something else, and I fell into a drain when I was a teenager.
I've done that a few times.
Yeah, my ankle is off to one side now, and
So is it like because we don't check it early, or we don't get it addressed early, that it actually, we leave it and we let the pain go on, or like sometimes it's on and off, and then when we go old, older.
What's interesting now is, okay, let's go back to the national service boy, because that's for me is a very interesting person. This is a person who, and myself, national service and all that. So when we were in the military and we were running around and getting injured and all that, we would we would not divulge, or for fear of being labeled as someone who's a slacker or something like that. But at the same time, when you think about our national servicemen, these are boys who are essentially like training athletes. So why can't these boys have the same consideration that athletes do? I.e., why aren't they getting the proper muscle conditioning? So one very common example of the national service boy is, they go around running and all that, and they end up with kneecap wear and tear. And so this kneecap wear and tear is called chondromalacia patella. It's a very, very early form of arthritis. And essentially what happens is the kneecap going up and down like that, when you're running and marching and all that, gets all soft, and it at that point becomes very prone to getting gouged out with a bad fall or something like that. Tragic.
But
The kneecap, right? So then what happens is these boys, in time, develop odd behaviors in order to avoid the painful spot. So what they'll do is they'll begin to walk funny, they'll avoid turning their knee in, and before you know it, and they do this subconsciously, before you know it, the muscles on the outside of their thigh start overdeveloping. And the muscles on the inside of their thigh become underdeveloped. Now, I have seen multiple, and this is men and women. With women, it's slightly different because their hips sort of grow wider, and that pulls the kneecap off to one side. So that happens. But with men, it's often because, it's an imbalance in muscle, and then it pulls off to one side. So then why aren't we sort of going in there, releasing the muscles on the outside of the knee and activating the muscles on the inside of the knee? So you asked me earlier about my practice. So this is actually the kind of thing that I'm very interested in, because I think with the right training and intervention, you can often, and this is an opinion because I actually looked up the data on this. There was one study that was done as a cohort study some years ago in America among college students, and what they did was they found out, they interviewed a whole batch of college students and found out if they had any injuries, and then they followed them up subsequently to see if they had arthritis. There was a study, there was just too much of fallout and they couldn't trace everyone. But certainly injuries in the past do result in arthritis, although the association is weak. And so my opinion is that if we can somehow get to these people early and teach them about muscle training and tendon release and ligamentous release, and more than that, it's this term called proprioception, and proprioception is essentially knowing where to place their feet when they're running, getting the right balance when they're running. I just not 3-4 days ago, there was a person I trained with at the gym, and I would see the way she would run on the treadmill, and I would say, this is not going to go well. Because what she was doing was she was turning her legs outwards, and she was sort of doing that. And as you do that, essentially what you do is you overtrain the muscles on the outside, you undertrain the muscles on the inside, your kneecap pops off, and you begin to get severe pain. And so she did one of these treadmill challenges, and I said, okay, here it comes. And sure enough, I was working out, she came up to me, and then she started asking me about her knee and all that. And then I looked at her, and her knees literally were like, her kneecaps were like pointing out. And usually we get an X-ray to make the diagnosis, but it was right in front of me. And I said, so I pulled out my track bands, and I said, so this is my knee. You can see how it goes this way. Now look at you, and her knee was off to one side.
Okay.
And so that's just one example, but I can cite you many examples of similar situations in the upper limbs and the shoulders where people don't quite pay attention to these subtle things. Now, when you are younger and you have strength, you have stamina, and all of that, you'll just power through. You'll see a 2.4 kilometer running track, and you'll just power through, and you feel you can do it, and then you become very aware when you're a lot older. And like my case, I started training
that you shouldn't have done that.
Yeah, no, I would, with my height, a guy like this guy, myself, we get severe injuries, and part of the reason why I have this insight into these injuries is I've just had so many, and they come from disordered kind of exercise and not being aware, not listening to your body, It's kind of a funny bone, if you believe in design and all that, it's just badly designed. So you have the femur, and the femur has got these two bally